This is the Deseret News National Edition, when your family needs to know more.
Good morning. Welcome to the Deseret News National Edition. I'm Dave McCann. Mental illness is a major health concern that impacts many families. The Substance Abuse and Mental Health Services Administration recently released the latest estimated rates of mental illness among adults. According to the survey, Utah is the highest rate, followed by Oklahoma, West Virginia, Oregon, and Washington. New Jersey, Illinois, Nevada, Connecticut, and North Carolina have the lowest rates. Dr. Peter Delaney is the director of SAMHSA's Center for Behavioral Health Statistics and Quality, joining me via Skype from Washington, D.C. Dr. Delaney, good morning.
Good morning.
How was this survey conducted?
Well, this is part of our national survey on drug use and health, and it's a representative sample that we gather annually, about 68,000 homes, gathering data from individuals and then sometimes in pairs. And it's nationally representative of people who are non-institutionalized and living across the country and ages 12 years and up.
Why do some states have higher rates than other states?
But, you know, we really can't, we don't look for causal reasons for that, but I think what is clear is that you can see from the study and what you've said already that the rates of mental illness across the country vary from state to state, just as the rates of drug use across the country vary from state to state.
So what do you want states to do with this survey?
Well, this is a survey that actually helps states look at and target areas they might want to think about for improving public health in the nation. For example, you may have very high rates of, say, serious mental illness, which is mental illness that really creates some significant dysfunction, or you may have much higher rates of what we would call any mental illness, that are not really creating significant dysfunction in a person's life, but does interfere with their life. And it depends on where that is and how you decide to use your money in targeting interventions and prevention interventions and treatment interventions to help reduce and prevent those kinds of illnesses.
Dr. Delaney, what did you find most interesting from this survey?
Well, actually, we tend to look at these surveys and over time, and you know, we're pretty clear that a lot of the rates are holding steady. And then when you take that into account, the level of drug use in the country, you begin to put together a picture of the kinds of behavioral health problems that each state has, not only mental illness, but substance use, tobacco use, et cetera. You know, that some people might find it very useful to look at what we've just released recently called the Behavioral Health Barometer, that looks across the states not only at specific mental illness, but also at substance use, a number of different kinds of drug use, and to try to look at what is the state of their behavioral health and the state of treatment and the state of medical expenditures for mental health and substance abuse.
All right, Dr. Delaney, thank you for your information. Thank you for joining us this morning from Washington. Mental illness impacts the entire family. We all know that. Here's some perspective on what it's like to live with and how one family found help and hope.
Labor Day weekend, the first weekend of junior high,
seemed to happen in a split second.
A family's life suddenly shaken.
One moment we were coming back from a family picnic and everything was fine and wonderful. Her dad said something to her in the car and she just...
From then on, 12-year-old Kelsey began to experience dramatic mood swings.
I started to feel more anger at the things that I couldn't change.
She started dressing differently.
Things were getting worse.
And then the breaking point.
The therapist came out and said that Kelsey had expressed suicidal ideation.
Her parents were given only one option: commit Kelsey to a mental hospital.
The thing that's really vivid in my mind is watching them take her down the hallway to where the locked doors were and seeing her go behind those doors.
On the other side of those doors, a young girl who felt betrayed and confused.
The first night was the scariest because they send someone into your room at night while you're sleeping to go through your stuff again. It feels more like a prison than it does a hospital.
A decade later, Kelsey's hospitalization still haunts her and her mother. They both continue to battle her mental illness, diagnosed as bipolar disorder.
When you're bipolar, you have all these ideas going through your head.
Again, we thought, okay, we'll treat her, she'll get better, it'll be done. Not really realizing it was going to be something we would pretty much deal with for the rest of her life.
The pain comes and goes, but when it does come, you wish it was physical because that's something that can be treated.
Mental illness often engulfs families like a black hole. They don't know where to turn for help.
It was very lonely when she was first going through it.
4 million children in this country suffer from a serious mental disorder.
In junior high, I remember I was called a witch a lot, and I got bullied a lot.
In any given year, only 20% of children with mental disorders receive mental health services.
You need to know how to advocate for your children.
Wendy is now a mentor for NAMI. She helps families navigate the labyrinth of mental health services.
The support of knowing that other people had gone through it and made it out okay on the other side was huge.
Kelsey is also involved with NAMI. She teaches a class to teens on how to cope and live with mental illness.
It's very nice to know that you're not alone.
And she seeks out people who've overcome their illness.
I use them for symbols of hope.
A crucial part of Kelsey's treatment is allowing her mom's involvement.
There needs to be more communication with, kids and their parents.
Frankly, this is something I haven't been good at, really trying to understand what they go through.
5 in the morning.
Kelsey lets her mom keep track of her medications.
10 at night, because there are so many.
And also allows her to attend appointments with doctors.
Their biggest frustration is that they are not in on their loved one's care.
For many families who live with mental health disorders, there's no easy fix.
Sometimes it's harder to find, but there's always hope.
And with support and access to treatment, recovery is possible.
Certainly, finding hope and support's a key part of recovery. Deanie Wimmer reporting there. Lois Collins has covered mental health issues for years for the Deseret News. She is with us this morning. It's nice to see you again. How far has America come to kind of erasing the stigmas that come along with mental illness?
This is a classic case of making 2 steps forward and 1 step back, but the good news is you do make a step forward that actually sticks. People are much more willing to talk about mental illness, I think, than they were in the past, and I think that there's a better base level understanding. National policies are starting to address it better as well, so I think we're making progress.
It wasn't too long ago, it seems, when we may have had an issue and would be told to man up, get over it, deal with it, because no one really knew that you could have so many different mental health issues that could be treated. Are we just smarter now, or we realize that we don't have all those answers?
I don't know if we're so much smarter now as we were so dumb back then to say things like that. It was just dumb. It's like telling a diabetic, you don't need your insulin, just suck it up. Come on, let's move on. It doesn't work that way with mental illness. And what has changed is that it's pretty broadly accepted now that it's a medical problem. It's not just mental. It involves your body. It involves your brain's chemistry. It involves all sorts of things. But it's not just something that you're kind of in a mood or you're not coping well. There are actual things going on. There are treatments that can help.
Biggest problems for families that you've covered that are dealing with mental illness?
General lack of understanding by people not in those families and sometimes within the families. People don't like to talk about it. They still feel like mental health is sort of a personal failing. If you're mentally ill, there must be something wrong with you. Sure. And it's not the same as having a broken leg or cancer in how other people view it. And it's scary. And because it's really scary, people don't want to talk about it.
Let's talk about LaDonna Gatlin, related to the Gatlin brothers, a motivational speaker, also at one point considered suicide. Tell us about her story.
She actually attempted suicide. She's this wonderful motivational speaker, a very dedicated, outspoken Christian, great singer, was part of the musical group with her brothers. It was when she left that they became the Gatlin Brothers. She just slowly saw the colors fade from her life and could not figure out what was going on. And it turned out that she had a mental health condition called anhedonia, which means actually inability to feel joy. It's the opposite of hedonism. So her husband would go to work and she'd watch him out the window, and as soon as he got to the end of the driveway and took a right turn, she would close the curtain, set her alarm, and go to bed. And she'd sleep all day just trying to escape what was going on in her mind and in her life, which was sheer misery. And finally one day she couldn't do it anymore, and she took a massive amount of pills, and was she would say she was very lucky that she survived it. Got treatment, continues to maintain her mental health, does very well, and motivates a lot of other people to talk about it and to get better. And
you've got to have that, don't you? You have to have someone who's been to the edge to tell folks, hey, this is how you get to the edge and what you can avoid.
Absolutely.
All right, Lois, thank you very much.
My pleasure.
Good to see you. You can read much more about LaDonna Gatlin's story at DeseretNews.com with Lois Collins reporting. The return of the Cosmos series has put science and religion under the spotlight. When we come back, we'll discuss why some folks think the series is less than sympathetic to believers.